Concealment of birth is a growing concern that poses a risk to both mother and child, especially if the pregnancy itself is also concealed.
It is a very risky and life-threatening act to conceal a pregnancy and even a birth. So these include things like hypertension in pregnancy, which can lead to strokes, the mother fitting, which is eclampsia, and risking her life. And when it comes to delivering on your own without any medical attendance, that also is quite risky because the mother can bleed or hemorrhage, even to the risk of death.
Both concealment of birth and child abandonment are serious criminal offenses with far-reaching medical and psychological consequences.
So the women, when we see them at the time of presentation, after the delivery, sometimes they are even brought in by police after a case has been discovered. We first and foremost attend to her medical health more than the social, which really is the underground or the underlying factor. The woman ends up being at risk of even having a criminal offense. And this is a concealment of birth. It's a legal issue.
While many psychosocial factors contribute to this problem, health authorities say there are several safer ways to terminate a pregnancy, and adoption is also an option.
We can decide based on the person's options or beliefs to put the baby for adoption if that's what they want to opt for. But of course, the C-top is an option. We think is the last option in a sense that there are so many things that can be done before a person even comes to C-top. The illegal abortion is another issue that is really hampering this kind of service.
A coalition of organizations under Baby Savers SA are advocating for the legalization of baby saver boxes as a last resort for desperate women.
In 2010, it was found that 3,500 babies were abandoned. Also, because of the COVID-19 pandemic, the number of 3,500 has increased exponentially. As an organization, Baby Saver South Africa advocates for the legalization of a safe method of infant relinquishment through a baby saver. Now, a baby saver is a box situated in a wall of a charitable institution that allows a mother to anonymously leave the baby in the box, and the baby will be taken care of by care workers situated on the other side of the box.
She says a number of organizations in the country provide a baby saver box, but this option is not legally recognized, rendering it ineffective. Sintle Englihihi, SABC News, Mahikeng.